Hello, it's Jamal Kassouma. I'm talking on my page, consultant ENT surgeon. I'm going to talk today about indication of removing the adenoids and the tonsils. Okay, the first indication is more than, I'm talking about the tonsils first. It's confirmed episodes of tonsillitis more than 7 times a year for 1 year, or more than 5 times a year for more than 1 year. This indication number 1. Indication number 2, it's obstructive sleep apnea. We remove the tonsils with adenoids and to relieve the airway. The patient complaining of his stop breathing at night many times an hour, and we have to do it as very quick as soon as we can, because if it's left untreated, it will increase the pressure of that pulmonary artery, the artery which is going to the lungs, and cor pulmonaire, or what they call it, failure of the right side of the heart. Therefore, it's very harmful. It should be diagnosed and relieved by removing the adenoids and the tonsils. The third indication of removing tonsils is suspicion of malignancy. If there is one tonsil bigger than the other one, should be both removed to be examined under microscope by a pathologist. Or sometimes you find an ulcer persistent ulcer over one of the tonsils. This is suspicion of malignancy and should be removed. Now the adenoids: loud snoring, can't breathe through the nose, always mouth open, and is part of sleep apnea, or causing fluid in the middle ear. We try sometimes, the adenoids is lymphoid tissue like the tonsils. We treat it sometimes, and there is what we call it infection of the adenoids. I usually treat antibiotics, for full course antibiotics, give antihistamine. If there is nasal allergy, give some steroid nasal spray, which is safe for children above 3 years old. If they respond to treatment, fine. If not, we take the tonsils out. It's a safe surgery by taking the adenoids and the tonsils. It doesn't have any side effect. Just in children, it's very little pain, and we give it by some painkiller. The wound will heal within 2 weeks. But the good thing, even there is some sore throat after surgery, it will be the last sore throat in his life. If it's less than 5 times a year, please don't take tonsils out. There is no indication to take the tonsils and adenoids out below the tonsil, certainly below the age of 3, unless there is obstructive sleep apnea. Therefore, before 3, it still have a function in the immune system. We don't remove it unless there is obstructive sleep apnea. But if we have to do what we do, we take the adenoids out and we do tonsillectomy. What tonsillectomy means is remove part of the tonsils. I'm talking about below 3 years old. We take the adenoids out, take part of the tonsils to relieve the airway. Therefore, still some lymphoid tissue which play a role in the immune system. Therefore, consult your doctor. This is the main guidelines, and it's international guidelines to take the tonsils out.